Hi everyone, welcome back to my channel. In this video, we're gonna talk about my online client's Budi, who lives in Indonesia, and he's contacted me a couple of weeks ago, and we started his rehab plan exactly 5 weeks ago. In this video, I would like to share with you his progress and how is he getting on so far based on the rehab plan that we started for him. Budi was suffering from disc bulges, and when he got his MRI report, he was very panicked what to do, and they didn't give him very kind of details plan or clarity what he has to do and what he shouldn't. He's been taking bed rest and he wasn't doing much, but he was still suffering with back pain. And when he contacted me, we basically gone through his online plan and what he has to do. And in this last 5 weeks, he's been doing really well, and I'm excited to share his results and his testimonial. How's he getting on through an online plan? If you're watching this video, make sure to like this video, make sure to subscribe my channel for my weekly update, and I would be happy to answer all of your questions regarding your injury. Leave me a comments and I will be happy to go back to those questions and give you some sort of clarity. Let's get started. If you've never been in this channel, my name is Bob. I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. If you're suffering from chronic lower back pain, disc bulges, disc herniation, sciatica pain, or spinal stenosis, or any other type of lower back pain, I'll be happy to help you to recover with simple tips and exercise plan through an online program, and you can start this plan right away. I help many of my patients online all around the world through a rehab plan online, and you can literally start your plan right away. You can watch the testimony of these clients underneath of this video and have a look at see what we do in the online program, and you can get an idea if that's something that you would be interested to get started. You can always contact me through my email and through my website, and we can go through a discussion. What would be your plan for your recovery to get pain-free? Make sure to subscribe my channel for my weekly update, and don't forget to press that like button. Let's get Budi, what I would like you to share with people, you know, there are a lot of people like yourself who has disc bulges, disc herniation, and watching my content and my channel, like yourself, who started program initially with me. The reason that you started training with me was because you watched some of my video, I suppose, and you saw people got results, and you started contacted me, and we started your training 1 month ago, right? And maybe just share with people what happened, Budi. What was the story? Why did you contacted me? And then we're gonna go through your progress, because your progress has been really good so far over the last, I suppose, 4 weeks. Maybe just share with people what happened.
Yeah, I had these injuries from 1st January, and then it didn't get any better for these 3 months. So I got panic, and then my symptoms got worse. Yeah, and that's why I went through all YouTube videos, search how to solve the this bulge and everything, and then I found out one of your video.
Got you.
So, and then I also saw the testimony of online clients, right? So that's why I want to contact you, and then
Got you.
yeah, I started your program 1 month ago.
Of
Course, at first, right? But of course, until now, also I still want to completely have the pain gone. But yeah, the pain was extremely reduced now a lot.
Usually, yeah. What was the symptoms? What was the pain initially before you contacted me, Budi?
Sometimes it's tingling all the way to the leg. Then sometimes stiff, or my thigh become very hard, and then even the pain also went around my thigh, my groin. Yeah, everything around that area.
Yeah. Now, and what was the level of the pain, Budi? Let's say out of 10.
6 to 8, I can say that.
Yeah, 6 to 8. Yeah.
Yeah. Even I was very afraid that I will go surgery, because the pain was become worse, not better.
I get
since 1st January. Yeah.
I get you. Yeah. And what's the pain right now? Like let's say if you
1 or 2, I can see. Yeah.
1 or 2 is in comparison to 6 or 8 is huge difference, I suppose. And do you still feel that tingling? Because what we discussed today, you mentioned that the tingling is totally gone from the foot.
No more tingling.
That's amazing, man. That's a huge progress. And tell me, Buddy, in regards to, I suppose, like, you met probably some people there in your own country. Where do you live, Buddy? Because you can share that with people.
Indonesia right now.
Indonesia. Yeah.
Yeah.
Okay. And did you check with anybody because you got the MRI, I suppose.
Yes.
And what they told you about MRI when you got your MRI, Buddy?
Yeah. First doctor said I have bulging disc. Then
Yeah.
second doctor said I have degeneration disc.
Yeah. Degenerative
Need to
changes in your
replace
lumbar
a new
spine.
disc or do the fusion, spine fusion.
Spinal fusion. They recommend you
Yeah.
basically surgery right away.
Yes. Yes.
Okay, yeah, but I mean, like when I look at your MRI report, there was a definite like L5S1 disc bulges, and there were some degenerative changes, I suppose, in your L4, L5, L5S1. But I suppose did they recommend you any treatment or any rehab exercise over there, or what they told you besides surgery?
One doctor said I shouldn't do any movement, restrict my movement, and do some corset, but no movement. Like yeah, just rest. Then the second just said that I will have this pain forever, so I need
Oh
to do
my God.
surgery to get it gone.
Yeah,
Yeah.
that's like a very very I suppose like harsh opinions I suppose which
Yes.
like I think that's really panic you and freak you out after doing
Yes.
those
And
appointments.
during the time that when the doctor said that I need to have surgery, that the time that my pain get worse, or maybe I get panic or I did
Definitely,
something wrong. Yeah, that's the worst part. Thing
I would
around
say so.
last last 2 months, I can say. Yeah.
Absolutely. And what did you do then after that, Buddy? Did you went and see any other physio or chiropractor or anybody else there at home?
Did I did therapy like
Uh-huh.
acupuncture,
Uh-huh.
but also it didn't work. At first, it worked just for 1 or 2 weeks, and then the pain was horrible at that time. Become horrible. So that's
Yeah, yeah.
at that time that I was panic, and then yeah, I searched a lot, browser, website, YouTube, and then I found your program.
I got you. I got you. Yeah. And tell me now, okay, since we started your rehab plan, maybe share your experience about the rehab plan that we have, because we've been going through your rehab plan now over the last 4 or 5 weeks, I suppose. And how did you find the exercises? How do you find the overall consultation that we had with me in a first day, let's say? Because I think the initial consultation is hugely extensively. We go through a lot of information about you, your life, your work, your lifestyle, etc. Maybe share with people your own personal experience. How was that, Buddy?
Okay. At first, you just ask about my condition, detail about my condition, my life, my age, whatever, and then you give the analysis, and then you give some exercise. And during that time, it was difficult to do the exercise. Yeah, and in the few
Initially,
days, I got pain all over my body because I'm not get used to it. And then I think after 1 or 2 weeks, I already got used to it. But you give me more exercise
yeah,
until now.
yeah, exactly,
So
exactly. Which
and
means
then
you challenging you in somehow.
yeah, yes, but I feel get stronger, and also I get fit better.
Yeah,
Like I can wake up in the morning and then don't get tired, and also
you have more
in the
energy.
night I don't get easily tired and sleepy.
Yeah,
But
you
I can
sleep better
sleep
as well.
well
Yeah,
this
that's
time.
brilliant. That's brilliant. That's
Yeah,
brilliant. And did you find the exercises like I suppose challenging, Buddy?
very challenging. Every time that I meet you, you always give me challenging work to do.
No, this is not
I thought that
necessarily rest.
I can
Yeah,
get rest a bit because I already get used to with the 2 weeks program.
I
But
get
after
you.
that, you give me more and more and more.
I get you. I
Yeah,
get you. Yeah, but the reality is that I think this is good that you're discussing about this. A lot of people think that with rest they can get better. They might be get pain free by resting, but passive rest not necessarily going to give you long term results, because in some stage in life you need to do some activity that challenge your back, and you will get challenged with that hugely, and the chances of getting sore again is really high. because you've been resting only, which means by the fact that you've been doing more activity, your pain is hugely down to 1 or 2. Your tingling is gone, and you're feeling fitter and stronger over the last 1 month, I suppose. You know what I mean? Which means I'm so happy to see you progressing, Budi, because you're not even here to see me in a day-to-day living. I haven't touched your back, you haven't gone through or any manual therapy, etc. And the goal is to get you back playing golf. You interested to play golf? You want to go back and do some running, etc. I'm excited to progress your plan and get you back to the gym. You already start swimming. How does it feel when you swim now?
I don't feel pain. Last time, before I have started your program, when I swim, I feel back pain,
Yes.
But I just swim because a lot of people say just swim, just swim. But now it feels nicer when I do swimming.
Yeah, I mean, with the combination of the exercises and the swimming. But in regards to the plan that I sent it to you, Budi, did you find that plan easy to follow, which means the structure?
Yes, it's very easy. And because you have the YouTube video, so it's just sit up and then you ask me to send the video and then you give me the feedback. So actually it's not that difficult as long as you want to commit with the structure.
100%, 100%. And in regards for you, that you see that you're monitoring your pain, your stress level, your sleep, your seeing time, and let's say your day-to-day living activity, that sheet, you think it helps you to see your progress? Because the pain was initially pretty high, and now when I look at your Excel sheet, the pain is like 1 or 2 in a day-to-day living, which is a huge progress. And you're on the green zone. Do you find that is encouraging to see progress and see you that actually doing better?
Yes, because my goal is not just like this. I still want to get better and better.
Of course.
So of course, seeing the result is getting better, I feel more
motivated,
energetic, and motivated.
Absolutely.
Yeah.
Absolutely.
But of course, sometimes that also still feel down because I still haven't had a normal life that I used to be. But when I see the progress, wow, it's good. Yeah.
100%, man. I mean, the thing is that I think there's a huge anxiety and fear factor after meeting those 2, I suppose, orthopedic that you met them and they told you don't do anything, don't use your body, you need surgery, otherwise you will have this pain forever. I think that mentally really drains your confidence. And within this program, my goal is not to get you just pain-free. My goal is to get you back that physical and mental confidence. And that's not going to happen overnight. Is a slow progress, and you can't take tablets for it. You know what I mean? To get more confidence, you need to build up that confidence over time and gradually build up your movement and strength. And the goal is to get you back to the gym, slowly, gradually progress your plan. And I mean, I'm so excited, man. I'm happy to see you. I mean, I think you look much more happier than where we met 1 month ago, man. You know what I mean? Without you knowing it. Budi, would you recommend this program to people like yourself who has, let's say, disc bulges, disc herniation, or they've just lost what they do? Would you recommend this? Did you find this genuinely helpful for yourself?
Yes. This program is very useful because before I started this program, I saw YouTube. I think I did the wrong exercise, so that's why my pain get worse.
Got you.
So it's good, and it's good to have a mentor or people that understand about the pain so that you don't get any worse. Because when you have this pain, you want to get better as soon as possible. Like me, I did the wrong way.
Of course.
I did the exercise wrongly, and I get worse instead of better.
Which means if you have the clarity, you definitely do much better, isn't it?
Yes.
Yeah. Listen, Budi, thank you so much for sharing your own feedback, man. I'm delighted with your progress, and we're gonna keep you progress. And we share another video in a couple of months' time. And when you're back to the gym and playing golf, that's another goal that we're gonna take. Okay. And thanks again for your time, man. I appreciate your time. Thank you for watching this video. I hope you guys find this video helpful. If you have any question regarding your injury, leave me a comments. If you need further assistance, as I mentioned earlier, we can organize an online consultation for you to go through your case in details and get an idea of what you can do for your recovery. I help many patients online all around the world through an online plan which is simplified and is detailed, and you can literally follow steps for your recovery to become pain-free. Make sure to have a look at my videos, send me a message, send me an email, and we can definitely have a chat and see what can be your recovery road, and I can explain for you what steps you have to take. If you have any further question, leave me comments. If you haven't subscribed my channel yet, make sure to subscribe and press that like button. Until next week, all the best.